All right, let's dive right in. This is your practical guide to safe prescribing in telemedicine, and we're going to be focusing specifically on India's Telemedicine Practice Guidelines, or the TPG. The whole point here is to get you absolute clarity on what you can, and more importantly, what you cannot do when you're practicing remotely.
Okay, let's start with the single most important thing you need to remember. This quote right here. This is the bedrock of everything else we're about to talk about. When you write that prescription remotely, the legal responsibility, it's all on you. 100%. There's just no gray area here.
So, before we even touch on which medicines are okay, we've got to cover the absolute basics. These are the ground rules, the non-negotiables that you have to meet for any teleconsult to be safe and, legally sound.
Okay, these are your foundational duties. First, you've got to establish a proper doctor-patient relationship. Then, you have to do a decent examination with whatever tech you have available. And of course, any prescription has to be clinically justified. But here's something really important to remember. What you can prescribe actually changes depending on how you're talking to the patient. Is it video, audio, or just text? And is this the first time you're ever speaking with them, or is it a follow-up? That distinction is absolutely critical. All right, so let's get into the real practical stuff the guidelines give us. I'm talking about the medication lists. They're broken down into 3 simple groups: List O, List A, and List B. Honestly, getting a handle on these is pretty much key to your day-to-day telemedicine practice.
So, first up, we have List O. You can think of this as the green light list. It's your safest category by far. We're talking about low-risk, over-the-counter type medicines that you can prescribe no matter how you're consulting, even if it's just a simple text chat.
And here are some perfect examples of what's on List O. You know, the basics: ORS, paracetamol, antacids, zinc, maybe some common cough and cold medicines. The kind of stuff that's really for symptom relief, super important for public health, and very safe to prescribe remotely.
Okay, now this next part is where you really need to pay attention. The difference between List A and List B is huge. List A, well, you can prescribe those drugs during a first consult, but only if the patient's history is crystal clear. But List B, that's a different story. It's only for follow-ups, only for patients you've seen before to continue their care. And believe me, that is a hard and fast rule.
So let's take a closer look at List A. Here you'll find things for pretty common conditions: anti-allergics, antiemetics, topical creams, that sort of thing. You can even continue meds for a chronic disease, as long as the history is solid. But, and this is a big but, you have to be cautious. You need a solid justification, especially if you're thinking about prescribing antibiotics. You really have to be confident that your remote assessment is enough.
And then we have List B. This list is all about managing long-term chronic diseases. Think antihypertensives, anti-diabetic meds, thyroid medications, stuff like that. The key thing here is that you absolutely must have an existing clinical relationship with the patient. You are not starting these treatments from scratch over a teleconsult. You're simply continuing or tweaking a plan for someone you already know and have treated before.
Okay, now we get to the absolute red line, the do not cross boundary, the strictly prohibited list. And let me be clear, the guidelines couldn't be more absolute on this. These medications can never, under any circumstances, be prescribed via telemedicine.
So what's on this list? Well, it's exactly what you'd expect. All Schedule X drugs are out. Narcotics like morphine, fentanyl, tramadol, completely prohibited. The same goes for controlled psychotropics and any other habit-forming drugs. There is zero, and I mean zero, flexibility here. Even thinking about prescribing these remotely is a major violation. So why the hard line? Well, it all comes down to safety. The reason these are prohibited is because the risk of misuse, abuse, and diversion is just way too high. And maybe even more importantly, from a clinical standpoint, it's just not possible to do the kind of thorough physical and psychological assessment you need for these drugs over a video call. It's all about keeping the patient safe. That's the bottom line.
This leads us perfectly into our next really important topic: knowing when to pump the brakes. You see, safe telemedicine isn't just about what you can prescribe. It's just as much about recognizing the red flags, the signs that tell you to stop what you're doing and refer the patient for in-person care immediately.
So what's the first major red flag? It's simple: bad information. If your patient can't really explain their symptoms, or their history is super vague, or they don't have the reports you need, you just can't move forward. Your entire assessment is built on shaky ground, and prescribing anything at that point is just too risky.
Now, this next one should be obvious to all of us, but it's so important we have to say it out loud. any acute, severe symptoms. I'm talking chest pain, shortness of breath, confusion, anything like that. These are absolute 100% no-goes for telemedicine. These are emergencies. They need hands-on, in-person examination right away. No exceptions, ever.
And it's the same story in mental health. There are clear emergencies that are just not suitable for a remote consult. If you hear any hint of suicidal thoughts, if someone seems to be in active psychosis or is showing severe aggression, you simply cannot manage that safely over a call. These situations demand an urgent, in-person psychiatric evaluation.
And finally, you've got to think about the medicine itself. Ask yourself, does this drug need physical monitoring? Things like BP checks, ECGs, or regular blood tests for meds like lithium or clozapine. If the answer is yes, then you absolutely cannot start that therapy via telemedicine. It's just not clinically safe to do so. Okay, so we've talked about what you can prescribe and when you need to stop. Let's wrap up with the two things that are going to protect both your patient and you. Really good documentation and a crystal clear follow-up plan. These are your safeguards.
Think of this as your documentation checklist for every single teleconsult. And remember, every entry has to be time-stamped. You've got to log the patient's consent, note whether it was a video or audio call, record all your findings, and clearly state your diagnosis and why you're prescribing what you are. And maybe most importantly, you need to detail the follow-up plan, including the exact red flag warnings you gave the patient.
Remember, the consultation isn't over just because you've sent the prescription. Your duty of care extends beyond that. You have to create a safe, clear follow-up plan. This means telling the patient exactly how to use the medication, defining when you'll be in touch next, and specifying those red flags that should send them straight to a hospital for an in-person visit. No ambiguity.
So look, if there is just one thing you take away from all of this, please let it be this. In the world of telemedicine, your detailed, thorough documentation, done right at the time of the consult, isn't just good practice. It is, without a doubt, your single greatest legal and professional protection. It's your shield.
YourMedLawyer, protecting doctors, empowering patients.